Yeah, I would actually be careful to compare the two because they're really written with two different intentions. Okay. I think the Canadian clinical guidelines are written for clinicians, just for practical implementation. These are the tools that we have in Canada. This is what's evidence-based. This is how we treat obesity, right? This is the standard of care of how we treat obesity. The Lancet Commission really tried to answer a bigger question, which was kind of what is obesity, right? They actually identified that among their panel of 20 plus experts, obesity experts, only a third of those experts didn't consider or only a third considered obesity a disease. I'll say that one more time. So for the Lancet Commission, they convened, over 20 experts in the field, and only a third of those experts agree that obesity is a disease. So it really highlighted one of our crucial starting points of should obesity be treated? Is this a medical disease, something that the medical community should own? Or should it continue to exist in the wellness industry world where we're focusing on lifestyle changes and physical activity, gym memberships, nutrition plans, and not get too much into the whole medication piece, right? So I would be careful to compare the two because I think they really serve two different purposes. Yeah, I think the clinical guidelines from Obesity Canada are fantastic. They're very user-friendly. They're kind of formatted online as well and free for anyone to access. Um, and they are 100% aligned with what we do as clinicians in the United States. We treat obesity as a medical disease. We look at it from the perspective of from a holistic level of care, right? How is obesity affecting a person's life medically, functionally, psychosocially? We look at the whole person. Um, I think the Lancet Commission was, I've said before, a little bit of an academic exercise to take a step back. Let's not yet think about it as a clinician or a surgeon or a policymaker, but let's look at the science and think about how obesity is defined as a disease. So it takes us back to what is a disease? And a disease is really a condition that causes harm, right? And what the Lancet Commission was trying to to hone in on was what is that harm? What is that harm? Is it just excess weight on our knees causing arthritis? Is it the end result of cardiovascular disease, heart attacks, and stroke? Is it a psychosocial, like depression or anxiety that may be societally driven? What is that harm? And they came together and identified, what defines that harm, or in their words, illness, what defines that illness as part of obesity, and helped us define where excess adiposity or excess fat may just be preclinical obesity, where there's no actual harm, no illness, and then where there is clinical obesity, where it encompasses that illness or harm, and that level should be potentially treated more urgently, maybe with a different set of tools or with a different rhetoric, even. I don't think they went as far as to say this should be treated, and that shouldn't be treated. It's more of how do we perhaps risk stratify this very large population of people who have excess adiposity according to a BMI criteria and be more precise in the options that we can offer them. Yeah, there's a little bit of that. A little bit of perhaps, that could be actually one interpretation of it, right? If we were to think about the Lancet Commission implications of clinical obesity and preclinical obesity, clinical obesity may be something we in the medical community would definitely want to own because it has the fatty
Hmm.
liver, it has heart failure, it has these other pieces of it that we are comfortable and are very familiar with treating. Whereas preclinical obesity, if there's no evidence of harm, if there's not yet any evidence of illness, could that be treated with just lifestyle modification? Could that exist outside of the medical community? I think that's a question. It's a good question. I personally, my opinion is the answer is no. I think we've been treating people with preclinical obesity for a while just based on their BMI, and we found that there are demonstrations of improvements either due to treatment or just improvements with respect to prevention. So we know that 10, 15% weight loss reduces your risk of type 2 diabetes. Okay, by some estimates, reduces it by like 97% with certain medications. So I think prevention is another goal that sometimes gets lost in the conversation. Uh, but we're not trying to choose either or. It's not as doctors, should we treat clinical obesity or preclinical obesity? We do want to treat both because there are benefits to managing both. So I think, but that's the kind of conversations you get involved in when you think about the definition of obesity from that commission perspective.